My name is Alex Athey. I'm one of the surgeons here at JIS Orthopedics, a partner practice of Ortho Alliance. I specialize in first-time primary hip and knee replacement, but also redo or revision hip and knee replacement. Hip replacement is one of the most successful operations that we perform, but it's important to consider how your surgeon is going to do it. Utilizing the direct anterior muscle sparing approach, patients are often experiencing less pain. They're able to get up, walk the same day, and they're able to get back to doing the things that they want to do faster. It's a technique that aids the surgeon in allowing you to replace your hip, but also recover as smoothly as possible. Traditionally, hip replacement surgery was performed through techniques that ultimately needed the surgeon to cut through muscles or tendons. And while effective, these approaches had their own drawbacks, specifically slower recovery, more pain, and post-operatively, patients would need to abide by certain activity restrictions. So a lot of times when I'm in the office, patients come and talk to me. They ask questions like, am I going to be on a walker for a long time? What kind of activity restrictions am I going to have? And these are really important things to consider, and all things that the direct anterior approach was really utilized and developed to address. The direct anterior approach was an approach designed to do a hip replacement without disrupting any muscles or tendons. That's why it's called muscle sparing. So when you do the operation, you simply spread the muscles apart, do the operation, and lay them all back down. Because we don't cut any of these muscles or tendons, ultimately, this leads to less trauma to your body and less pain post-operatively. And it also allows your hip to feel more natural and not have to abide by any post-operative restrictions. So in short, it's essentially performing a hip operation with the least amount of trauma that you could possibly have to your body. Muscle sparing approach means just what it sounds like, obviously. You're not cutting any tendons or muscles, so you have less to heal. That ultimately equates to less pain, less swelling, and faster progression of getting back to walking and other activities of daily living. You'll be up walking the same day, and you're rapidly getting back to doing the normal activities of daily living, such as getting in and out of a car, climbing stairs, and even returning to some of your hobbies. Because you're not cutting these muscles, the strength and the confidence that you have in your new hip rapidly returns. It's pretty rare for my patients to really need a gait aid such as a cane or a walker for more than 2 or 3 weeks. Really from day one, because you don't cut these muscles or tendons, you feel confident in your new hip replacement. Traditional hip replacements often required strict post-operative protocols and restrictions due to the fact that they disrupted muscles and tendons. Typically, that ended up meaning you couldn't bend your hip more than 90 degrees or you couldn't cross your legs. Because the muscle sparing approach really preserves a lot of the soft tissues and the muscles, you don't have to really follow those restrictions. So most of the time, patients who have this operation don't have any restrictions after surgery. What this ultimately leads to is more confidence, freedom, and ability for you to resume your functions faster and safer. Absolutely. The direct anterior approach is a proven, safe method that has been utilized by surgeons worldwide. At our center, we perform thousands of these operations. This gives us the confidence that we can perform it efficiently and safely for you. We're also able to get patients up and moving and discharged the same day the vast majority of the time. Believe it or not, 5 to 10 years ago, this was actually somewhat uncommon. So the combination of our experience and the muscle sparing approach ensures a safer and smoother recovery for our total hip patients. Patients are up and walking the same day after surgery and discharging home the vast majority of the time. Beyond just the physical recovery, you'll notice the confidence in your new hip immediately. It's stable, secure, and designed to move more naturally so that it feels like a hip that you had before it was diseased. Outside of the confidence that you'll gain from your hip replacement, you'll also gain confidence from our team. Our center and our staff have been performing outpatient direct anterior total hip replacements for many years. They know all the protocols to make you feel safe and secure prior to discharging home. Combined with the muscle sparing approach and the confidence in our team, you will have an excellent result. If hip pain is holding you back and impacting your quality of life, there are options for you. With the direct anterior approach, a hip replacement can be a faster and smoother recovery than you might think. How do you know it's right for you? Schedule a visit. We'll talk about your own diagnoses and discuss the risks, benefits, and alternatives to hip replacement. Let's get you back to feeling good.